Hello, my name is Dr. Malorani. I'm going to be offering you a two-part seminar. The first is going to talk about the opiate healthcare crisis in America, and the second is going to be about how to recognize and respond to an opiate overdose. I've been a professor here at MCPH University for the past 8 years, and over the last 5 years, I've been working a lot on projects related to the opiate healthcare crisis. In many cases, I work with students like yourselves, and so if working on projects related to the opiate healthcare crisis is something that interests you, we should talk at some point. But today, I want to talk to you about the opiate healthcare crisis and its root causes, and then we'll talk about how to recognize and respond to an opiate overdose. So one thing that we know for sure, we talk about what is the opiate epidemic. We know that there's an abundance of opiate prescriptions that are given to Americans each and every day. It was a study done in 2015 by the National Institute of Drug Abuse. Their study showed that 1 in 3 Americans took a prescription opiate painkiller in 2015. And if you compare that to other countries, we're an outlier. Most other countries only prescribe opiates when it's end of life or for cancer treatment. And frankly, that's how the United States handled opiates until the mid-1990s. And the reason for that is simple. We've always known that opiates are highly addictive and a very dangerous drug to prescribe, and that we save it for very special circumstances. But that changed in the United States around 1995, and the problem continues on through today. So the fact is that Americans consume the majority of the world's opiates. There are various studies out there. Some indicate we consume 35%, and there are other studies that says up to 80%. The truth is, however, that whatever that number is, it's vastly more than any other country on a per capita basis and in total. And here's the other thing that we know about opiates. They're very addictive. And as a result, there should be very limited prescribing of opiates. So one of the things that CDC has found in their studies is that as many as 1 in 4 people who receive an opiate prescription for a long time struggle with addiction. And so one might ask, what do you mean by long term? So the data, and this is also from the CDC, the risk of continued opiate use for some people can start as early as 4 to 5 days. And certainly anybody who's taking it for 30 or 60 days, if they're in the risk category of people who are likely to be addicted, then we're opening up a Pandora's box that, quite frankly, we can't close. So what we have to recognize is that there is a certain percentage of the population, whether it be 5 or 10%, if we give them an opiate prescription, even for a short period of time, they're going to struggle in trying to stop. And so what we also know is that today, 130 Americans die on average each and every day due to an opiate overdose. And since the late 1999 through 2018, or during a 20-year period where the data is available, 450,000 Americans have died from an opiate overdose. And the sad truth is, most of this was preventable. Most of this happened because of either greed or negligence on the part of the parties involved. And if opiate overdoses and deaths aren't enough, then here's another startling fact that says that 1 in 20 Massachusetts residents has opioid use disorder. So that's 5% of Massachusetts residents. This was based on a study that was done by Boston University researchers. So the CDC, if you go to their website, they indicate about 2.5 million Americans have an opioid use disorder, which essentially means that these people are addicted to opiates. The study done at BU said that number is probably vastly understated. So whether the number is 2.5 million or whether the number is 10 million or 15 million, what we know is that we have millions of Americans who today struggle with opioid use disorder, which essentially means they're addicted to opiates. And for the most part, the people who have become addicted to opiates started on their journey with the prescription. What I'd like to do now is to share a PBS documentary. The documentary actually runs about an hour. I'm going to show you about 10 minutes of it, but I'll put the link to the entire documentary if you want to watch it. This will give you some insight in terms of the root causes and also provide you the impact it has to individuals.
Every time I or one of my colleagues writes a story on the opioid epidemic, we get responses from families, fathers, mothers who have buried children a week earlier, and they want to sit down and talk with us. And sadly, it's the same story. It's the same tragic set of circumstances, except for the names and faces. There's just no end to these stories.
In my job, you deal with a lot of people who suffer losses. And there are people who lose a loved one and they cannot move on. There are people who lose a loved one and turn around and say, what can I do? That's what Jennifer was doing.
So Cameron was my son. He passed away 5 years ago of a heroin overdose. I never in a million years thought that, my boy would be a heroin addict.
So like I said before, and I'll say it again, I love life. I love all of its fights.
Cameron was a student and athlete at one of the top high schools in Albuquerque, New Mexico.
He was wrestling and he broke his collarbone and he had to have surgery. So he was prescribed Percocet. He was injured about 3 months later again in a football injury and broke his other collarbone. And he didn't require surgery the second time, but they gave him more painkillers the second time. You're given 30 pills by a doctor and you think that they need to take all 30 of them because otherwise why would they give you so many? It didn't even cross my mind that it was something that was dangerous or addictive or anything like that.
It's fairly typical kids would get injured, whether they were in wrestling, football, gymnastics. Suddenly they're on a road and it's a fast track and it doesn't take very long.
Cameron's road to heroin addiction was paved with prescription painkillers. Eventually, he turned to cheaper and more readily available street drugs. Nearly half of people who use heroin were first addicted to prescription painkillers.
That wasn't his, goal in life to get addicted to opiates and then move on to heroin. I didn't even know that opioids and heroin were related.
It's not that there are young people out there who are deciding one day that heroin sounds like a fun drug to try. Before they're using heroin, they're opioid addicted, and that addiction develops through prescription opioids. The pills are very expensive on the black market. They switch because it's much less expensive. We've seen overdose deaths in that group rise very rapidly because the heroin supply has become more dangerous. It has fentanyl in it now.
The migration from prescription pain pills to heroin has changed the demographics of drug addiction in America. While heroin use has increased in most socioeconomic groups, some of the greatest increases are in demographic groups with historically low rates of heroin use.
Every person I've ever talked to who ends up a heroin addict, they talk about how when they were doing pills, they would never do heroin. They would never put a needle in their arm. Crossing those thresholds into the next phase, it's literally 5 minutes. Because you go from, I've never hit a needle in my arm till a needle was in my arm. And now we're off and running.
I was completely shocked. I quickly found out that, drugs don't discriminate. They're everywhere.
For an addict like Cameron, what happens is that drug replaces everything. It replaces your love for your parents. It replaces your love for your friends, your other family members. You steal, lie, cheat, do whatever you can to get the money to get your next fix. That sounds like a cliche, but it's a cliche because it's true. That's what happens.
Since my son passed away, my life has completely changed. I felt like nothing was the same anymore and nothing meant as much anymore. And so it was very difficult. And it's still very difficult. Even though it's been 5 years, it still feels like it was yesterday.
As with many parents who lose a child to opioid addiction, Jennifer has devoted her life to helping others. She started Serenity Mesa, a youth addiction recovery program.
Anybody want to swap you, Joe?
We do long-term treatment for young men age 14 to 21, and we provide not only drug treatment and counseling, but life skills, high school education, and job placement, job readiness programs, things like that. And we're able to really dig deep into some of the trauma and some of the underlying issues that may have caused their substance abuse in the first place.
Helping others deal with addiction has helped Jennifer face her own loss.
It helps to help other people and to see, all the young men at Serenity Mesa and the progress that they make and how well they do. They're battling to save their life right now. They don't realize it because they're so young. And that was the issue, I think, with Cameron, is he was just so young. He didn't know he was dealing with a life or death situation. He just thought he could quit whenever he wanted to and everything would go back to normal. They say that you learn to live with grief. You don't get over it. It doesn't go away, but you learn to live with it. But, I still think about him all the time.
It's been said to me that these people aren't bad people trying to be good. They're sick people trying to get better.
With the opiate population, it's different in the fact that a lot of times they don't see this train coming down the tracks. It's an injury, it's a surgery, and oftentimes that's where it starts.
Hey, Bill.
How are you?
Good.
Nice to see you again.
Yeah, it's so it's been 2 weeks now.
I was 15 years old and I had a tumor in my spine. Spent a week in the hospital. They sent me home with a bunch of medication. I ended up being addicted to opiates. I gave up. I didn't care what happened to me. It's a pretty horrible feeling when you don't really care if you live or die.
Okay, so what's up for this week? What do you have planned?
My son loves dinosaurs, so I think this weekend we're going to go to a fossil museum. Should be fun. I'm excited. It's amazing what you think is normal turns out to be this terrible ordeal that I dealt with for the past 15, 16 years. It takes over your life. It's sickening to even think of the things that I've done and the people that I've hurt, and just not to even care at the time what was going on.
I think deep down, every addict has a desire to not be living that life anymore. I think that desire has to be strong enough to want to change, to outweigh the draw, the pull from that part of the brain that's been sort of hijacked by the addiction.
Opioids are one of the toughest addictions to break. Opioids produce an addictive euphoria that alters the chemistry of the brain. According to the National Institute on Drug Abuse, treatment programs that focus only on abstinence do not result in long-term recovery.
The reality is there's no fix, there's no cure for this disease. There's a lot of work involved in this. It's not just a quick fix or a miracle cure.
There's not a magic bullet out here. We don't have a one and out. Well, come in and we'll save you and you're going to be all good. It's a long and difficult road.
Opioid addiction is a chronic disease, like diabetes or heart disease. All need to be managed for a lifetime. Treatment for addiction typically includes some form of individual or group therapy.
What you become when you get high is not who you are. Who you are sitting in this chair today, fighting, struggling with the courage, the faith, and the hope that tomorrow could be a better day. The disease can be arrested. You can lock it up and lock it up forever, and as long as you don't put that key in the lock and turn it and let it loose, you can be free from the horrors of addiction.
Things got really rough for me before they ever seemed like they were going to get better.
I can remember one time I was working with a family, and the day the young man was to leave our facility, the mother thanked me. She said, "Thank you for curing my son." And I said, "I'm sorry, there's really no cure. This is a daily reprieve contingent upon what your son is going to do moving forward."
It's hard as hell to bring yourself to a program like this that do something.
Brain caused by opioid addiction. Medication-assisted treatment is a proven effective treatment for individuals with opioid use disorder. Use of medications helps to wean the brain off opioids and improve outcomes for addicted patients.
One of the most effective treatments is a medicine called Suboxone or buprenorphine. It will control people's cravings and it reduces the risk that they're going to die of an overdose.
Opioid replacement with buprenorphine is one of those things that for many people is a game changer.
While medication-assisted treatment improves the chances for recovery, there is a lingering issue of why treatment for opioid addiction often fails.
Oftentimes, it's not just one treatment, it's multiple treatments. And that's where I think the frustration comes in, where people think that, recovery doesn't work. It's fruitless. It's just not going to happen. My loved one's been through this 3, 4, 5 times.
Once somebody becomes addicted to opioids, it's a lifelong problem. They're not going to get better by checking into a rehab for 30 days or getting detoxed. The treatment is generally going to be very long.
What we need to do is look at addiction as a continuum. Treatment doesn't end at 1 year, doesn't end at 2 years. I think what we're faced constantly as families, friends, employers that think that a stint in a rehab for a month means potential success. But
no way I can allow us to have a dog because Michael kept asking for a dog.
We knew that Michael was in pain a lot. And towards the end of his life, he really suffered.
We were really terribly lonely. So I finally gave in, and much to my surprise, this dog has given us such joy.
Death changes you. It completely does. And you want to know, why did Michael have to die?
At the age of 12, Michael was diagnosed with Crohn's disease, a painful gastrointestinal condition. As he got older, doctors prescribed powerful opioid medications to treat his pain. After Michael's death, his parents obtained pharmacy records that showed Michael was prescribed 185 pain pills over a 1-month period.
I just couldn't believe that the doctors did this to him. It's indefensible that they did this to an 18-year-old, young man. Changed him chemically forever.
This thing takes a beautiful person and turns him into a monster. That's my beautiful little baby.
Yeah, who are you?
You know what happened to you?
Yeah.
What's going on? And you don't understand what's going on.
The reason that the United States is in the midst of a severe epidemic of opioid addiction is because the medical community began to prescribe opioids very aggressively. And as the prescriptions went up, rates of addiction and overdose deaths went up right along with the increase in the prescribing.
More than 240 million prescriptions are written each year for opioid pain medications, enough for every adult American to have their own bottle. OxyContin, Opana, and Vicodin are among the most frequently prescribed and most commonly abused prescription opioids. These powerful drugs can literally hijack the brain.
The effects produced in the brain by oxycodone and hydrocodone are indistinguishable from the effects produced by heroin. When we talk about opioid pain medicines, we're essentially talking about heroin pills.
It is a very powerful drug.
There are so many tragic stories out there. And so what we should think about is, how did we get here? What created the opiate epidemic in America? So certainly there is plenty of blame to go around. The pharmaceutical industry, in particular Purdue Pharma and the Sackler family, they really brought us OxyContin, and they really developed a marketing strategy to convince the American medical community to prescribe more opiates. But the truth is that having worked in industry most of my life, that I understand that the companies stretch the truth. Sometimes they lie to sell their products or services. What I don't understand is how the medical profession bought the lie, bought the half-truths. There was this movement in the mid-90s to deal with pain management, and a lot of that movement was actually driven by the pharmaceutical industry. So that culminated in recognizing pain as a fifth vital sign, and that really opened up the door for the pharmaceutical industry to jump in and to convince the American medical profession that prescribing opiates could be done safely. Now, the strange thing about this is we've known for a couple of centuries that opiates were highly addictive, very dangerous, and were only given to people at end of life or people with cancer treatment. But yet, somehow, the American medical profession buys the lie, and they start to prescribe opiates in phenomenal numbers. And that continues even through today, even though opiate prescribing has come down. We're still an outlier as a country, still far too many opiate prescriptions. So here's some facts about the current state of things. Healthcare providers across the US wrote more than 190 million prescriptions for opiates in 2017. I think the 2019 number is about 160. So it is coming down, but that's still at a rate of 58.7 prescriptions per 100 people. And despite the guidelines to limit the opiates as a first approach to managing most chronic pain, primary care clinicians write about half of all the opiate prescriptions. So each day, more than 1,000 people are treated in the emergency room for misusing prescription opiates. You know, we've already talked about the fact that 130 people die every day. And there is somewhere between 2 and 15 million Americans who are suffering with the lifelong chronic disease called opioid use disorder. So this is a big problem, and we know that roughly 20 to 30% of patients prescribed opiates for chronic pain misuse them, and that sets them on the path to people ultimately becoming addicted to opiates, and in some cases dying, and in other cases suffering with that disease. So as Dr. Kolodny points out, when we talk about opiate pain medicines, we're essentially talking about heroin pills. Now, Dr. Kolodny is really one of the American heroes who's trying to convince his colleagues in the medical profession that we need to move away from opiate prescribing and try alternatives to help people with pain management. Of course, we'll continue to provide opiates to people with cancer and end of life. But for people who go to the dentist, people who go to the emergency room, for acute pain or more routine type of pain, there's too much risk involved with giving people opiates. So let's listen to Dr. Kolodny one more time, and then
The main reasons that we have failed to respond appropriately to the opioid crisis is that it was misframed, and intentionally so. Certainly by 2000, 2001, there were reports coming from Appalachia, New England, about OxyContin overdoses and addiction. And it was clear we were having a problem with opioids. From the beginning of the crisis, the way the issue was framed, particularly by pain organizations that were getting funding from opioid manufacturers, the way the issue was framed for policymakers was as if all of the bad things that we're hearing about, all of the opioid harms, policymakers were told were limited to so-called drug abusers, and that millions of patients were being helped by the increase in prescribing. And so policymakers were told that, your challenge is to try and do something about this drug abuse problem without making the chronic pain problem worse. Millions of Americans are suffering from chronic pain. And if you were to promote any kind of intervention that would result in reduced prescribing, you'll be punishing the pain patients for the bad behavior of the drug abusers. So you've got to balance these two competing problems. And the reality is that we don't have these two distinct groups. And opioids are not safe and effective treatments for the vast majority of people suffering with chronic pain. Millions of patients with pain have become opioid addicted. Thousands of patients have lost their lives. And so the opioid crisis is not an issue of drug abuse. It's not an abuse crisis. If you frame it that way, it suggests that the problem is people behaving badly, taking dangerous drugs because it feels good, and they're accidentally killing themselves, and that maybe the intervention is to make the pills hard to crush so people can't abuse them. It's not an abuse crisis, it's an addiction epidemic. The reason we have historically high levels of overdose deaths, the reason we're seeing heroin and fentanyl flood into non-urban areas, the reason we're seeing a soaring increase in infants born opioid-dependent, children winding up in the foster care system, outbreaks of injection-related infectious diseases, is because we've had this very sharp increase in the prevalence, the number of Americans suffering from opioid addiction. And if we're going to bring the epidemic under control, we have to stop creating new cases of addiction through more cautious prescribing, and we have to see that the millions who are addicted have access to effective treatment.
All right, so certainly we have enough blame to point at the pharmaceutical industry and the American medical community. There are other things we should think about too. One is this issue of stigma. When we think about the root cause of the opiate healthcare crisis, many people do believe that this is a self-inflicted injury. But the reality is that most people start down the pathway to this problem innocently. They take an opiate prescription from a dentist or a doctor, or in the case of younger people, they may take it out of their parents' medicine chest to experiment and party and things like that. And so what ends up happening is that people who develop an opioid use disorder often feel ashamed, and they feel they don't want anybody to know about it. And so one of the big problems we have is there's so much stigma involved in developing opioid use disorder that people try to hide it, and they do effectively. But in hiding it, it prevents people from openly discussing it and treating it. And the other part of it is that we have to educate healthcare providers and the general public that this is a chronic disease and that we should treat it just like we treat diabetes or hypertension or any other chronic disease. So some other things that I think we have to think about is increasing access to medication-assisted treatment. So, as has been noted so far, this is a lifelong chronic disease. And just like any other lifelong chronic disease, there's opportunities to treat this disease. One is medication-assisted treatment. Buprenorphine, naloxone, methadone are all highly effective in helping people get and stay in recovery. Another thing is that we have to be more insistent upon policies being put in place. So there's a law called the Right to Know. It exists in 15 states, but sadly not here in Massachusetts, nor in New York, or in a lot of large industrial states. The Right to Know says that if I'm going to prescribe you an opiate, I have to have a conversation with you about the risk of addiction, about the alternatives that are available. And so that's something that we have to insist that happens. And that's part of the whole communication education process. Today, New York is the only state that waives the co-pays for naloxone. So I think making naloxone more accessible, more available, we know it's a major intervention in saving people's lives. We know, for example, in Massachusetts, we lose 5 to 6 people every day to an opiate overdose. But we also know that 10 times that number, 50 or 60 people every day, are rescued with naloxone. And then, we have to be serious about funding the recovery process, the treatment process, helping people get back into the workforce, and so forth. And those things are, these are all major things that are at the root of solving the bigger problem. And the one thing that you should be encouraged about is that other countries are there. Portugal, Spain, and other countries are well beyond where the United States is and have really done amazing work to eradicate the problem. So we can do it, but it's up to each of us to step forward and do our share. So I hope you'll consider moving forward and doing something about this healthcare epidemic, which we can make a big dent in improving and hopefully someday eradicate.